In this set of videos, you're going to hear from your colleagues about safety events that occurred at work. It's really important that we get comfortable talking about these events with each other so we can make Rush safer for our patients and ourselves.
We always want to think about ways that we can do our work better, and honest discussions help us to think of ways to do that.
And it's critical that we talk about these things as well as report our mistakes and near misses.
This story is about correct patient identification. As you're watching, think about how a similar situation could happen in your workplace.
Rush is a busy place. Sometimes our jobs are hectic, and when we're in a time crunch, it's tempting to do things too quickly. Rushing through a process, taking shortcuts, using workarounds, or multitasking can lead to mistakes. Mistakes that impact our patients and us. Speaking up about an error is not just the right thing to do. It is something we can all learn from, as our colleagues explain.
I got a text to go pick up the patient in 12:03. When I got to the floor, I asked the clerk for the trip slip for 12:30.
Thank you. Take care.
You're welcome. I got them kind of mixed up. It's been a hectic day, so I proceeded to the room, picked up the patient, took the patient to the testing area. When I arrived to the testing area, I stop at the desk and I give the chart to the clerk, and then I park the patient in the holding area where we're supposed to. And then that's when the PCT said, "Oh, this is not the right patient."
What went wrong?
I just proceeded in to get the patient and assumed that that was the right patient.
Following policies and procedures ensures safe care for every patient, from every employee, every time.
Good morning, sir. How are you this morning?
I'm great. How are you today?
All right. My name is Reggie. I'm from Transport. I'm here to pick you up to take you to your procedure.
All right.
Once you get to the patient room, you're supposed to introduce yourself and you ask the patient their date of birth and their correct name.
It's a little cool in the hall, so I'm going to put a blanket across you, okay?
Thank you very much.
The good news is that the radiology tech caught it and the patient was not scanned for a test that was not supposed to be done to them.
In this case, what went wrong has reinforced how to do things correctly.
You have to go through the proper procedure. Make sure you look at your pager right. Since that mistake has happened, I'm more conscious of what I'm saying to the clerk and what I'm asking for.
Good morning, Mr. Andrews. How are you today?
And when I arrive to the room, I've always asked the patient's name and date of birth to make sure that I don't make that mistake again.
Okay, sir. May I get your name,
Sure, it's Steve Andrews,
your date of birth?
July 9th, 1979.
I'm more aware about what I'm doing because if I was a patient, I wouldn't want to go through what I just put the patient through.
Following our policies and procedures matters. We all play a role in safe care for every patient, with every employee, every time.
Good morning, Mr. Andrews. How are you today?
I'm sure you would agree that these types of situations can happen in many places in the organization. Patient identification requires two patient identifiers, name and date of birth.
These processes have been put in place to promote the safety of our patients, families, visitors, and staff.
Please take the time to talk about this story with your team, and we encourage you to talk to your supervisor about ideas you have to improve the care we deliver here at Rush.
Thank you for making Rush safer for our patients.